Good morning, ladies and gentlemen. I am Colonel Dr. Anup Krishnan, and it is my privilege to welcome you to Week 3, Lecture 3 of this course on physical medicine and rehabilitation in sports. In this lecture, we'll be discussing the various imaging techniques which are available for the diagnosis of sports injuries. I'll be covering this as per the following outline: definition, a brief overview, salient features of the imaging modalities. We'll discuss about imaging for common sports injuries, the future trends, and conclusion. Imaging is very, very important for diagnosis of sports injuries because without imaging, you are treating and diagnosing blindly. There is a role of imaging for treatment planning, for monitoring of rehabilitation. How's your rehabilitation going? Is the tissue healing? Is the joint healing? Is the tendon healing? Is the ligament healing? All this can be picked up by proper use of imaging. And imaging also has a role in injury prevention. If you are able to diagnose a stress fracture at the stage of a stress reaction, you can prevent a stress fracture. Imaging also helps to differentiate between acute and chronic conditions. A brief overview: X ray is generally used as a first line imaging for fractures and joint abnormalities. Basically, anything to do with the bones can be picked up by an X ray. Musculoskeletal ultrasound is used for dynamic imaging for soft tissue injuries. You can see a lot of detail in superficial soft tissues such as tendons, ligaments, and muscles. And you can also see how the muscles and the tendons are moving when you put the joint under stress. MRI is best for soft tissue and ligamentous injuries. CT scan, it's a high resolution imaging modality for complex fractures. Basically, it is a very sophisticated form of X-ray which moves around the body and gives you slices of the body, which is then analyzed by a computer and images are given. In cases of suspected fractures where the X-ray doesn't pick up anything, CT scan can be used as a cheaper modality if you do not want to use MRI. Bone scan is a very good modality to detect stress fractures and metabolic bone diseases. If you have a stress fracture which is not being picked up on X-ray or CT, but you strongly suspect there is a stress fracture, you can do a bone scan. A radioactive dye is injected into the body, and this dye is picked up by the injured areas, and you get something called a hotspot. Fluoroscopy can be used for real-time imaging for guided procedures. Let's talk about X-rays. X-rays are the best for detecting fractures, dislocations, and joint abnormalities. The advantages: X-rays are quick, cost-effective, and it is widely available. Nowadays, you can also have portable X-ray machines which are small. Limitations: the soft tissues are not visualized very well, and it's commonly used in high impact sports such as football, basketball, and rugby. The commonly used views in sports injuries are the standard views such as anterior posterior, lateral, and oblique views. You may even use stress radiographs to assess the ligamentous stability in cases like ankle sprains and knee ligamentous injuries. If you want to use weight bearing views to detect joint instability and cartilage loss, you have to put the patient in a weight bearing position and then take X-rays. Computerized axial tomography or CAT scan or CT scan. Provides cross-sectional imaging with high detail, and it is useful for complex fractures of the face, pelvis, and spine. It may pick up bony lesions and small fractures which are not visible on X-ray, but it has a limitation that it causes higher radiation exposure. Magnetic resonance imaging or MRI. This is said to be the gold standard for soft tissue injuries. It is excellent for detection of ligament tears such as ACL, PCL, MCL, and LCL of the knee. Meniscal injuries, muscle strains, and cartilage damage. There is no radiation exposure with MRI, but it is expensive and is time consuming. There are several MRI sequences which are used in sports medicine called T1 weighted, which is best for anatomical details, T2 weighted, which highlights fluid and edema, STIR sequence, which is sensitive for bone marrow edema and for stress fractures, and DWI, useful for detecting ischemic injuries. Ultrasound imaging. MSK ultrasound is portable, cost effective, and offers real time imaging. It is used best for tendon, ligament, and muscle injuries because it allows for the dynamic assessment of movement abnormalities. Local MSK ultrasound is also used as a guidance modality for guidance injections such as corticosteroid and PRP injections. Doppler ultrasound, a highly specialized form of ultrasound which evaluates the blood flow and can be used for detecting vascular abnormalities. Useful for detecting deep vein thrombosis in athletes, assessing how much inflammation is there and how much is the neovascularization which has progressed in tendinopathies. It is also important for identifying arterial occlusion following traumatic injuries. Bone scintigraphy or bone scan. It is highly sensitive for detecting stress fractures, bone infections, and metabolic disorders affecting the bone. It may be used in endurance athletes such as runners and triathletes to detect early stage stress fractures. The limitation is lacks specificity, and in most cases, MRI is preferred. Fluoroscopy in sports medicine. It is a real-time X-ray imaging which is used for dynamic joint assessments and for interventional procedures. The commonly used areas are in guided joint injections for corticosteroids, hyaluronic acid, etc. It can also be used for stress testing of ligaments and for identifying joint instability. It is rarely used nowadays. Nowadays, MSK ultrasound is more commonly used for these procedures. Imaging for fractures. X-ray is generally the first line modality for fractures. CT scan is useful for complex fractures of pelvis, spine, face, etc. And if X-ray is inconclusive, MRI can be used to detect stress fractures. MRI is best for ACL, PCL, and MCL ligament injuries of the knee or any other ligament injuries of any other joint. Ultrasound can be used for assessment of superficial ligament injuries dynamically, and stress X-rays can help evaluate ligament instability in severe sprains. In muscle and tendon injuries, ultrasound is best for acute muscle tears and tendinopathy. However, MRI remains the gold standard for deep muscle injuries and complex tendon tears. and Doppler ultrasound can be used to evaluate vascularity in chronic tendinopathies. In cartilage injuries, MRI can be used with specialized cartilage sensitive sequences called T2 mapping. CT arthrography can be used to detect small cartilage defects, and X ray is used to assess the progression of osteoarthritis of the joints. In stress fractures, MRI is the most sensitive modality for early detection. Bone scan can be used if MRI is unavailable. And X ray offers limited sensitivity and is generally normal in the early stages. So, X ray is not preferred in the early stages. In concussions and head trauma, CT scan is the first line modality for acute intracranial injuries. MRI is used for detection of post concussion syndrome and for chronic symptoms. Diffusion tensor imaging is an emerging technique for detection of subtle brain injuries which cannot be picked up by normal MRI or CT. In shoulder injuries, first line is X-ray to assess fractures and dislocations. MRI can be used for detection of rotator cuff tears and labral injuries. And MSK ultrasound can be used for dynamic assessment of impingement syndromes. In knee injuries, MRI is the best for meniscus, ligament, and cartilage injuries. X-rays have limited use in knee injuries except in case of fractures and arthritis. And ultrasound can be used for evaluating bursitis and effusions of the knee. First line imaging for ankle and foot injuries is X-ray. MRI can identify ligament injuries and stress fractures. And ultrasound is used for assessment of Achilles tendon pathology and for ligament injuries. In hip and groin injuries, X-ray can be used for detection of fractures and impingement syndromes. MRI is the best for labral tears and muscle injuries. And ultrasound can be used for evaluation of sports hernias and for adductor injuries. Role of imaging in RTP decisions. Imaging helps to monitor the healing progression with serial imaging. You can do functional imaging for dynamic assessments. And imaging helps to do an objective evaluation so that you can prevent premature return and further re-injury. There are several advances in imaging technology. Three-dimensional imaging reconstruction has come in, which allows for better visualization. Artificial intelligence in imaging interpretation is being used more nowadays. And portable MRI or office MRI and on-field ultrasound devices for on-field side assessment is now being used in an increasing manner. Limitations and considerations for imaging. There is a cost and accessibility for advanced imaging modalities. Radiation exposure is a good concern for young athletes, and over relying on imaging versus clinical examination and clinical correlation should be avoided. Imaging should be used to confirm a diagnosis rather than to get a diagnosis. Take home message. Imaging is crucial for accurate sports injury diagnosis and management. We have discussed the common imaging modalities and their applications. Choosing the right modality depends on injury type and severity. And future advancements will combine diagnostic precision and help to enhance athlete care. These are the references, ladies and gentlemen, which I strongly urge you to go through. I seem to have finished, ladies and gentlemen. Thank you for listening. Thank you and Jai Hind.